I think that we say to the next one. Two very involved, like, what you said. One thing, I think I'm very involved, very involved.
Thank y'all for coming today. I trust you all have minutes from 11. We are all in favor. Very good. So, have 6 resolutions this month, more can do it, but, if you get them both, then that'd what?
If you want to, resolution requesting a budget modification, creating a transportation line in the early intervention budget and to transfer funds. You're mandated to provide transportation and other related costs that are necessary to enable an eligible child and the child's family to receive early intervention service. We would like to set the transportation line at $35,698, and this is funded at 49% state reimbursable of $17,492, and the remainder, the $18,206, will be from vacant positions.
I have, who's actually paying for that service?
There,
The family.
that is correct.
You find we don't have those assets that they just don't continue to get it.
That is a great possibility. We recently learned that we thought it was an optional service, and it is not.
Men.
And it's been that we provide that. We feel we're working very hard to be both for the staff.
Right. We don't take it that they were, mandated to make that. Everything that we do to the part.
And I had to do that.
Okay, and I think that this is, funded here, state university, I did a product with data. How that funded.
So this year, how we decided how to come up with this number is that we based it off 30 children receiving services 2 days a week. Round trip, average around 74 miles. That number will go up for that.
Yeah, I get it. So, it says as needed basis, but on here it also provides mileage reimbursement for parents.
Yes, that's what it's for.
It's just a mileage reimbursement.
It's mileage reimbursement, and if parents aren't able to split their time, there. If they're unable to, but they're need to go, then we have to provide
I guess that's one question. How do we,
it would be a, what's it about, like, we can do like a taxi transfer, if they do still need a parent, to go with the so it could be physical therapy, it could be if you can't see on the home, and then you need to go to a
we can start with extremely early today.
that's
Oh, yeah. Okay. All in favor? Aye. Opposed? Frank, you voting? You took a vote. Voting? You took the vote? Yeah, no, but the moment you took the vote, I see money not vote. Okay, well, I vote when it's time to vote. All in favor? Aye. I didn't vote no.
Is a resolution requesting a budget modification and an ARPA fund into the health administration budget for certification. And 23 ARPA funds was provided for the health department and were approved. So we could apply for accreditation to the SEP, which is Public Health Accreditation Board. The process began in 23 and we went through the regulation program. In 24, it was completed and we received approval to submit our application for accreditation. The internal audit process.
Right. This is, we double pass that for help. How long, once you send some, how long did that take? What happened?
1 year, we have 1 year to fulfill the documentation of funds.
Okay.
And we're working on it.
Favor? Aye.
Well, 18.3.
83 is a resolution to increase the capital project number 134, Silkwood Landfill. From the capital reserve number 195, Silk Road Abbreviation Reserve. The estimate for the 24 maintenance cost is $129,000, and I did make you a handout for the breakdown of what we're looking for. That is in the handout and the people search. Breakdown of what we're responsible for. Silk Road Landfill falls under the jurisdiction of the U.S. EPA. Maintenance is needed for the Silk Road to stay compliant with the EPA's operation monitor and maintenance guidelines.
Right.
The annual thing, and that also, they pay, all this thing. I have a question about the funding, these two different things. Okay, but what is the Silk Road remediation? That's what I thought. I said, man, I just called it a big, how does that get funded in the budget? Sure. It's a huge goal. That's all the lot. Yeah. Oh, yeah. Question. On big.
Aye.
Vote. There. 4.
84 is a resolution requesting the budget modification to increase overtime and the health administration budget. Due to the requirement of the senior accountant, the principal accountant has been working overtime to meet the demands of the increased workload caused by the state. Overtime funds have been depleted and many annual tasks need to be done, including state reporting and the 25 operational budget. Now, this is requesting the increase for overtime to $5,000, and it will, this money will be offset by increased consulting and no increase in ownership.
You're only able to build that temporary vacation.
That is correct.
It's the finance party.
Right, and that is together, so this is the permanent.
Well, that was still
That's correct. And they cannot happen.
it's going to probably be a couple of years.
Yeah.
Sure. I mean, I'm looking to hire somebody, I don't know. I don't know if that's.
We did hire an accountant to read and bill, we did the attendance today. Stop it.
Both questions. You fire yourself. It's you get off.
An accountant now and will live.
One question. All in favor? Aye. Both. Here. Wow.
85 is a resolution requesting the budget modifications, adding additional hours into the health administration budget. Health administration division utilizes additional hours through the year for preparation of cost reports, Article 6 state aid, and the operational budget. The $4,000 is requested by health during the 24 budget process, but it was left off. In the budget, health is requesting to add to the budget using funds to pay.
It's really a typographical error that
Inadvertent.
yeah, the big word. My wife inadvertently, I get a lot. I inadvertently forgot to,
But here the fund.
yeah. Question. All in favor? Aye. Opposed? Carried.
Is 86 is a resolution requesting a budget modification to increase additional hours and our children with special health care needs. That's children with special needs division that's comprised of preschool, early intervention, child find, and children that need special health care needs program. In January 24, a long-term time director retired. A new director was appointed from the Lynn. This left special education program coordinator position vacant. The current director has been filling the need of both positions. He's utilizing a small amount of additional hours to complete the task. The coordinator position has now been filled, and the need for additional hours still exists. So they will be totally trained. Health is requesting an increase with early intervention to add additional hours to the budget of $2,000. This is offset by unused salary, which is a requirement of previous directors, resulting in no change for local share.
Was it built from the department?
Wow. Oh, the director's position was, but the coordinator's position was hired on. She's doing very well. She's very favorite contracts very well. I don't feel like she wants to get training.
I think we could see you all there.
I think she's right. I don't want to. Or there. Then, you know, up there. I did a venture thing.
And are you at college?
I mean, nursing is still an issue I don't. Covering all of
Schools on, and also probably,
them.
so,
So I think it's a common, a lot of.
in what? All in favor? Aye. Opposed? Carried. Right, so, health department, okay.
Strategic planning and accreditation, we submitted the application for accreditation on May 13th, so we have 1 year to submit. So you can document it in the plan that we're talking about. Quality improvement, our first QI meeting took place on 5/8 with all divisions, reviewing their performance improvement projects that they are currently working on. That is the first of many. leadership of that. We plan to be supportive. Public Health Fellows Program is ending June 30th. We currently have 5 Public Health Fellows, all that will assume positions at the Health Department, which will increase the number of vacancies there. As a genealogist, 2 health education positions, and 1 a counselor and preventive position. Health education and emergency preparedness, vaping presentations at junior high and high school are becoming very, very popular. We get requests weekly to go out to schools and people. Several summer catering events are planned during the month of June. We are also working on a BJA, which is the Bureau of Justice Assistance grant. This funding, if we get it, for public health and public safety collaboration, we plan to use the money to include our post-overdose outreach, overdose fatality review, and primary prevention education for our schools. We completed our first chronic pain self-management program with 8 attendants that was very well received. We also are working on the 7-9 class that was at the Commons. That's our fall prevention that we do with our seniors, and we have over 10 participants. Training at PSS is scheduled for the 4th week, and we are offering Narcan to all PSS staff. Our purchases for PrEP, Public Health Emergency Preparedness, and the year grant. We're waiting on the deliver list to be finalized. We also have a new immunization campaign for our budget that is out, and we're looking to spend additional grant monies on other immunization campaigns by the end. And this is all that. Our overdose handout in your packet. The overdose fatality routine is in the works and planning stage. We continue to meet with New Jersey IDA and their OFR team to help us work through how we would like to set up our overdose fatality review team. And according to the CDC last report, the total number of overdoses has decreased by 3% from 2023, and Oswego County expected the same way. Wonderful. Healthy Families Program is at full capacity with 40 families. We are prioritizing referrals currently and committing on a limited basis. We received results from our April meeting for quality assurance visit with Prevent Child Abuse New York. We did outstanding. They are now piloting with us for a study on motivational interviewing techniques, and we have arrangements to start that training this August. We also received a review from the Center of Human Services Research, and we received 15 out of 16 on the performance indicators, scoring higher than the New York State average on all items. We are on the list to possibly take the child welfare protocol. This program allows us to increase the age in which we can accept a family into the program by working closely with each department of social services unit, child protective, and child service preventive unit. We can only met a child that is up to 3 months in age, and then this would allow us to have many children up to 2 years old. If selected to take on this program, of course we would get the funding to be able to do so, and we would also be able to grow our program more the next year. So more to come on that in the coming months. Environmental, a ratings clinic, full consultant community center. We vaccinated 204 pets. 164 dogs and 40 cats. The clinic and flash drive that took place on the 15th, we vaccinated 197 with $150 and 45 cents. Environmental aid for seasonal mosquito program started on the 28th, and we did have one return from last year. Children's camp packages are expected to come in. Also, we've seen an increase in our temporary local food service applications. Several comparable thefts are right. Our first of the season to reserve week meeting took place in May. It was well attended, but we did run into technical issues with the virtual meeting. Our next one is scheduled for August, so it's going to be middle veterans for the end of the school year. But program will currently follow 121 children. The single child health, we have 28 active, and we are following 2 community research. And then a division plans to table at farmers market in Oswego for about 6 weeks through the month of July and August. And then children with special needs, early intervention, 13 referrals for the month of April, and 23 and our current early intervention waitlist numbers is 168 full weeks. Down from like 200 that we have, so that's wonderful. 24 students patients are willing to travel for services. We're just waiting for an open spot. Waiting for teachers, 17 went for physical therapists, 13 on our occupational therapist list, and 2 on the wait list for teachers and staff. Some good news is led by 5 and beginning to see children at their Mandale site. They are currently training 12 of our EI children at this location. The agency is actively searching for a second speech therapist, and if they're successful, that will be 20 more of our EI children. That's the one that we right there. That's what I have. Good. What's called them for looking for the public health? They're like septic and things like that. Get started. We could help people on this. So we can get the money set. Always get right into the spell. The township, all we want is to really want to be also involved with the polls and things like that. They actually know the process. We have to get more involved with the and the also, you can see that we have that yeah, that's so like you get involved with that, the name of the physical part of that's what we do at the step. Also, how much of the client and yeah, coming together. So it's our health educators. It's a brand new program, and our health educators have all been trained on relaxation and how to not use medication to help with pain control. I personally want to follow up on that. Yeah, absolutely. That was the first of many programs. Okay.
I, question I, let me discuss here, and not discuss this stuff like that. But, sorry, recording paper about the bake shops, our, not even what the money from them, that type of thing. But what I'm wondering is there any way that it's in the city of Fulton, let's say we got two of them, big ones, one that I know of, but is there any way that we can, I don't know, in some way, shape, or form, put it down that, okay, another big shop, we've got permit to be able to run, he has to, every year, 2 years, he has to apply for a, permit to work in Fulton, like shop. Any way that we can put the two together to say, okay, we've been, caught with this, then we say, okay, because we were caught past year, see what can we do them and not to be able to help us get our money. I mean,
That would be a great presentation of the city of Fulton. I know they are committed to the office that they can define them. Well, and it's out of our jurisdiction, but it comes to it's a very difficult program. I think,
they tend to do the top, to give them the information to stay focused, that facility, business.
we don't contact the city of Fulton, no. No, it goes, no, but with office of the parent time are aware of it. We're not. Also, there hasn't been.
I mean, I'm against smoking business.
Oh, me too.
I mean,
Me too, 100%.
I'm just looking to say, okay, now here we are, we had this avenue to say, okay, you're selling stuff, that's here's the time, but we're not, we need to reflect.
But they are in here, and I already got the conversation part of their, like, their, what, the,
So the city of Fulton could, if they wanted to, say, okay, they might be the trail like this here. But because we've been, in the past, cited for it, we're not going to give you the permit. Well, that would be
wonderful.
Well, that's not, that's something that would help, But I know what they do, the guy, Paul, when he talked about that, he's closed it, open it up under another LLC, and it's the same guy. That, my understanding is you have three of them.
I don't know if the city's bond itself, but they don't sell.
No, they don't say that's not their job.
Right.
So that's not their job, but that's the health department's job. And what I want to do is coordinate the two of them together and say, okay, see if so many people that are involved are on board with, going to see what we can do to help out the health department.
If there were these.
Question. Say, all better?